Hello, I'm Dr. Eve. Menopause still seems to be a big secret across the world. Women are ambivalent and confused and not really well enough educated and informed about hormone replacement. They don't really know if it's safe, if the risks are too high, what the benefits are, and they end up taking stuff off the counter because they're so desperate to have a better quality of life. There are better ways of dealing with it. There are other ways of dealing with menopause. I refer to a letter from a woman. She says, I'm 61 years old, I'm healthy, but I suffer from vaginal atrophy. I take no estrogen, but would like to try and enjoy sex again. Please help. I do not want to take hormone therapy. I tried KY jelly, but it did not help. Of course, KY jelly isn't going to help. Vaginal atrophy means that the vagina no longer has any estrogen inside of it because the whole body has lost estrogen. And so any kind of penetration into the vagina is going to be painful because there isn't that wonderful smooth estrogen layer inside the vaginal wall to protect you as you are being penetrated, either with a toy, a finger, or any kind of penis. So just getting onto herbal stuff, just using KY is not going to be useful. It's not going to last long at all. I respect that women do not want to take hormone therapy. And of course, many women are not good candidates for it. And many women choose not to take it. I ask you, I urge you to find out why you're so opposed to it. Because we have research that shows how beneficial hormone therapy can be for women who are good candidates. One wants to look at your quality of life, not just your vagina, but your entire quality of life. Is it worth living without hormones because somehow you don't have enough information about the benefits of hormones? I urge you to talk to your gynecologist about that. In terms of helping this woman who is saying she doesn't want to take hormones, there are other things to do which can actually help you a little better. You could think about taking vaginal local estrogen replacement, which means your whole system doesn't become filled up with estrogen, those hormones that you don't want to be taking, but your vagina gets the benefit of it. And then you would begin to replenish and rebuild a wonderful layer of estrogen inside your vagina, which would certainly soften the blow, so to speak, of any kind of penetration. What you would also need to add on is liquibeads, KY liquibeads, not just the normal moisturizers and lubricants that they have, but this is a very specific product, KY liquibeads, which is only available in this country on my site, dreve.co.za. It's an ovule of silicone that gets inserted into the vagina, and once melted, it coats the vagina and makes penetration way easier. So I would recommend that you do that. I also recommend that you use something called smart balls because it's going to be difficult to start getting something into an atrophied vagina. You have to be really gentle. In fact, you probably should start with just your finger. And I'm looking at this pen. It probably should be a very small dilator, a very small vibrating dilator, something like the BG, which is available in my store, to begin to get the muscles of the vagina open and contracting again. And then you move on to something like this, which is called smart balls. Smart balls get inserted into the vagina and it's going to help the muscles to expand. So you're lubricating the vagina and you're expanding the muscles, and that's going to help you a great deal to get your vaginal atrophy taken care of. For more information, visit dreve.co.za.